All right, this is a tough little anatomy question, but I've seen it asked on the step, so here we go. We got a inversion and eversion. First of all, eversion, that's what it looks like. This is what inversion looks like. 32-year-old construction worker is brought to the emergency department after falling, twisting his right leg, immediate pain and difficulty walking. There's significant swelling and bruising on the lateral aspect of his knee and upper calf, and with tenderness just posterior to the fibular head. He's unable to lift his foot on the ground or walk on his heels. All right, walk on his heels. When he's asked to stand on one foot, he loses balance as his foot inverts, walking on his heels as his inverts, and then the plantar flexes involuntarily. Neurological exam shows a decreased sensation of the dorsum and the lateral shin, but normal sensation over the sole and medial leg. Okay, this is one of those questions where you're just like, oh my goodness, what is actually happening here? So the biggest points would be that there's this thing, there's the common fibular nerve, and it's frequently injured, where it winds around the neck of the fibula. And what does that innervate? The deep fibular and the superficial fibular. The deep does the anterior compartment that dorsiflexes. So you might see a dorsiflexion where you're trying to go like this, whoop, whoop. Well, you can't do that anymore because the deep is broken, the deep fibular nerve. Toe extensions, dorsiflexion, can't do that. Superficial, that'd be eversion. Whoosh, whoosh, superficial is eversion. So the man can't lift or evert his foot, and he has numbness at the top, but everything else is okay. Well, that's a common fibular nerve, right? Because the deep one does this, whoop, and then the superficial one does that, whoop. And so the fibularis longus helps evert the foot, as it's controlled by that nerve. That's the one that's not working. So it's going to be the fibularis longus. Yeah, really kind of hard question. There probably won't be this tough. Tibialis posterior, this will be your tibial nerve, that's inversion. So if we look at our photo here, that'd be our inversion, and that's intact. Gastrocnemius, the tibial nerve, that's plantar flexion, and that's intact. Soleus, that's the tibial nerve as well, and that's plantar flexion, and that's intact. Flexor hallucis longus is the tibial nerve, that's toe flexion, and so that's intact. So these guys are like plantar flexors. These guys three are here, and that's the inverter. So yeah, eversion, fibularis longus, but what you need to know is probably that the common fibular nerve is what's damaged here. And I'm trying to think of any other really important high yield points, but the common fibular nerve injury happens right there where there's the fibular neck, and there's the fibular neck is where you can just damage that nerve, and it splits off into the superficial and the deep. And then that gives you a foot drop, right? Because that dorsiflexion can no longer happen because the deep fibular nerve is damaged. And then this is asking about a superficial. So anatomy questions, they're kind of hard sometimes, but as we just go through them, hopefully it'll make it easier. So hopefully it was helpful. Ciao. We'll see you in the next vid.